All right, Mr. Flynn. Thanks for talking to us here at Kentuckiana Integrative Medicine. Is it okay if we put this video on the internet?
Yes, my name is Jim Finn, F-I-N-N.
Could you tell us what brought you to Kentuckiana Integrative Medicine?
I've been having problems with my knees for probably about 10 years, particularly walking down steps or walking down a hill, that sort of thing. And I wanted to do something to rebuild the cartilage in my knees before I ended up needing a total knee replacement, because I know sometimes that can be problematic for people.
And what did your MRI of your knees show? Do you remember?
I don't know all the details when it comes to that, but I know that I was having, not bone on bone, but I know that I'd had some arthritis in my knees, and so I was having some problems with clicking in particularly with my right knee, more so than my left.
And as I understand it, you had trouble with going down steps, sometimes up steps, is that right?
Yes, yeah, particularly down steps. Going up steps was better, but even that was a little bit problematic for me too. And this has been getting worse over time. So,
did anybody recommend surgery to you or not?
No, nobody recommended surgery for me, and I wanted to do something before it got to that point.
Okay. And so 3 months ago, you came to us for treatment, and what treatment did we do for you?
I had 1 million umbilical cord stem cells implanted to each one of my knees. I also had platelet-rich plasma done, and I had prolozone and prolozone therapy done at that time. That was on June the 7th of 2018.
Excellent. And so here we are 3 months later, and how are you doing?
I've noticed some improvement in the way I'm able to walk and get around more. So I've been doing warm water therapy and trying to do some things to make sure that I take care and get the maximum amount of the growth of the stem cells in my knees to rebuild the cartilage.
3 months after the injection, do you have any pain when you walk?
I'm doing really well there. I'm not really having pain when I walk. Occasionally I might have a little bit of a twinge, but that's pretty much it.
And we just had you walk down some steps. Did you have any pain walking down the steps today?
Very minimal. I had just a little bit of pain towards the bottom of the first set of flights. When I walked down the second set of flights, didn't have any pain there at all. So excellent. I've had a vast improvement.
Wonderful. So would you recommend this stem cell therapy to other patients?
I would certainly recommend that, and I think that it's important to get that done before your knees get too awfully bad. I do have a sister-in-law who lives in Lexington, Kentucky, and she has a client that comes into her store, and she actually had bone on bone and had stem cell implant done on her knees, and she had regrowth of the cartilage and has had a vast improvement as well.
Wonderful. Well, thank you very much for allowing us to interview you, and we wish you much health and success.